Skills and Innovation.
Thank you, Lead Minister of Labour.
Thank you, Mr. Speaker, sir. I beg to present the papers standing on my name under item 3C 511 of order papers and 3C 51. I thank you.
Thank you, Sergeant Atams. Honourable Minister of Labour, do you wish to speak to your paper?
Kitero kuti tulandire niso ku program ina ya wapafupi apo sapano pakanema wachani.
Thank you, Mr. Speaker, sir. No, because it's already been gazetted. I thank you.
Honourable Minister, you should move that the papers be referred to the relevant committee.
Yes, Mr. Speaker, sir.
Thank you, Honourable Minister. I take that one as I beg to move. Thank you. Therefore, the papers will be referred to the
to ministers for oral replies. I beg to move. Starting with Ministry of Health and Sanitation. I beg to move.
Government Whip, please come again. You said we should vary the order paper and go back to beginning with health. Okay. Honourable members, we have a motion on the floor to vary the order paper again in order for us to go back to general business under Ministry of Transport, questions to ministers for oral replies under Ministry of Health and Sanitation. Those of that opinion say aye. Aye. Those of the contrary view say no. The ayes have it and the motion is carried. I see a point of order. Is that a point of order in Chinji South?
Yes, it is. Yes, it is a point of order, Mr. Speaker, sir.
Chinji South, did you raise a point of order?
Yes, sir. Yes, Mr. Speaker, sir.
Thank you very much, Mr. Speaker.
Okay,
sir.
I take it we have one in Chinji South in Malawi. Which is in Chinji South? Honorable Kema Banjira, yours is in Chinji what? Honorable Chinji South, proceed.
Thank you so much, Honorable Speaker. I'm indeed rising on the point of order. The question time to the Ministry of Local Government was curtailed. to allow other business to go ahead. But my rising is that I'm asking if that can also come back, because the issue which was on the floor is very, very important about the CDF, and people are looking forward to it. So curtailing actually questions going to the Ministry of Local Government will not do us better. There were other people who were rising, wanted to ask the Ministry of Local Government for clarification of the same. So I'm pleading to the House if they can allow those who had questions to the Minister of Local Government to proceed with their questions. Thank you so much. I so submit.
Thank you, Mchinji South. Unfortunately, the matter has already been decided, but in good faith, I know the Honorable Minister of Local Government will come as we are going. We have enough time. I'm sure at some point he will come and say something. We know how important this issue is, and the minister is working day and night to solve this. I know about that. So he will come and explain more if we need him to. If it's very important, you can put it in writing straight to the minister, and I'm sure he'll attend to that. Thank you.
General business, item 2B, questions to ministers for oral replies.
Honorable Minister of Health and Sanitation. Question number 69. Sorry, Honorable Minister. Kasungu Municipal. Please confirm question 69 in today's order paper going to the Minister of Health. Kasungu Municipal. He's not in. Kasungu Municipal, are you in? All right, we will pen that one. Let's now move to Mwanza Central. Mwanza Central, are you in the house? Question number 70 in today's order paper. Not in the house. We'll go to question 94. Chitipa North. Yes, Honorable Chitipa North, please confirm.
Indeed, Right Honorable Speaker, I rise to confirm that the question appearing in today's order paper, number 94, indeed comes from the people of Chitipa North constituency. Thank you, I submit.
Thank you, Chitipa North. Honorable Minister of Health and Sanitation.
Good afternoon, Mr. Speaker, sir. Mr. Speaker, sir, I would like to thank the honorable member for Chitipa North, Honorable Fales, for the question, and the question reads. The question is to ask the Minister of Health and Sanitation to consider providing 2 ambulances to 2 health centers in Chitipa North constituency to ease transportation challenges met by referred patients who are currently ferried using motorbikes. The health centers are as follows: Kameme Health Center and Kapenda Health Center. Mr. Speaker, sir, through you, my ministry is aware that Chitipa District Health Office operates 6 clusters for ambulance services. One of these clusters covers Kapenda, St. Cynthia, and Kameme Health Centers, all located in Chitipa North constituency. St. Cynthia Health Center, being a CHAM facility, has its own ambulance. Kameme Health Center is situated approximately 32 kilometers from Chitipa Boma, while Kapenda is about 31 kilometers away. The two facilities have catchment population of 29,411 and 18,813 respectively. Currently, one ambulance serves both facilities and is stationed at Kameme Health Center. This ambulance facilitates the referral of patients from both centers to Chitipa District Hospital. Mr. Speaker, sir, my ministry acknowledges the challenges faced by the health center, and to be based at Kapenda Health Center has already been considered and included in the district development plan. Mr. Speaker, sir, in addition to that, my ministry has allocated a budget in the 2026-2027 financial year for procurement of ambulances. Once the ambulances are procured, allocation will prioritize facilities experiencing critical transportation challenges, including those in Chitipa North constituency. Furthermore, Mr. Speaker, sir, my ministry intends to leverage opportunities presented under the new CDF to support the procurement of ambulances for the underserved facilities. I thank you, Mr. Speaker, sir.
Thank you, Minister of Health. Honorable Member, I should have used your gadget. Thank you. Let me start with Lilongwe Zimsinja.
Thank you, Right Honorable Speaker. My question is about the human resource at Ben Health Center. We cannot talk about ambulances without talking about nurses, doctors at the center. We constructed the Ben Health Center using GSET, and it's covering 2,000 villages. But as of now, the policy ratio of a nurse to patient is very high. I wanted to know, in your planning, are you planning to send more nurses and doctors at the Ben Health Center so that when patients visit the health center by motorbikes, they need to find nurses and doctors at the health center? Thank you, Right Honorable Speaker. Thank you.
Thank you. Let me go to Nkatabe Central.
Thank you very much. Right, Honorable Speaker, sir. First, I would like to thank the Honorable Minister of Health because she personally visited my constituency. She visited Bwelero Dindan Clinic. Right, Honorable Speaker, sir, I would like to report and ask the Honorable Minister of Health in a supplementary question that, Madam Minister, the project you visited is up to now abandoned. It was being funded using the American government presidential initiative. I want to ask you, Madam Minister, whether you can support us by lobbying for resources to complete the construction of Bwerero Dental Clinic as well as Total Clinic, as well as to ask a supplementary question whether they can help us to solicit for a boat ambulance to enable patients move from the main Nkatabe, this hospital, to areas like Toto, where there's no road network, they're traveling by boat. A boat ambulance is necessary. We budgeted for an ambulance in the CDF, but as you have heard, that funding is not in yet. So I want to ask you, Honorable Madam Minister, for a boat ambulance for Total Clinic, as well as financial resources to complete the construction of Total Clinic and the Bwerero Dindani Clinic. Thank you, Madam Minister. Madam.
Thank you, Nkatabe Central. And if that materializes, we get that boat, we should name it a Davua. Members, I have one more. Zuzu City South.
Thank you very much, Honorable Speaker, for recognizing the people of Mzuzu Southwest to ask a supplementary question to the Minister of Health. The people of Mzuzu Southwest want to find out from the Honorable Minister on the status of the procurement of the dialysis machine from Mzuzu Hospital, because it's an issue of HSS, so want to find out the status at which point are they. Thank you very much.
Thank you, Honorable Minister.
Thank you so much, Mr. Speaker, sir. And through you, let me thank Lilongwe Sinja South for the question to my ministry, where he's asking about the human resources issue on a health center that I failed to capture the name in his constituency. Mr. Speaker, sir, let me ask the honorable member to write the request officially so that I can find out how best we can assist the people of Lilongwe Sinja South and what the issues are with this health center, since he asked the question under a question that was not related to human resource area. I would also like to thank Nkatabe Central for asking my ministry. Indeed, it was a great honor when I visited his constituency, where I inspected this project. And Mr. Speaker, sir, through you, let me indicate here that this clinic was being constructed under the Presidential Initiative on Maternal Health, and this was included in the budget, and the funds are available. And once again, I will make sure that I follow up and provide response directly to him to see where and how and the reasons that has led to the project story reaching this far. Mr. Speaker, sir, let me also thank the honorable member from Mzuzu Southwest for his question on the status of the procurement of dialysis machines in Mzuzu. Just to update the August House that indeed my ministry is in the process of procuring dialysis machines, and he has already set up space, construction, everything is already done. We are in the process of procurement of the actual machinery, and the funds for this activity were included in this year's budget, and everything is under control. Soon he will be appraised on the status of the dialysis machines in Zuzu. And just to indicate that this is also a priority for the ministry, considering that Zuzu Central is one of the central hospitals that currently do not have a dialysis unit within the central hospital. It is a priority for the ministry. Thank you, Mr. Speaker.
Thank you, Minister of Health. You have responded well. Let's now move to question 95, coming from Cholo Goliati.
Good afternoon, Mr. Right Honorable Speaker, sir. I rise to confirm that the question appearing on the today's order paper, question number 95, is indeed coming from the people of Cholo Goliath. I confirm.
Thank you, Honorable Minister.
Thank you so much, Mr. Speaker, and through you, let me thank the honorable member for Cholo Goliath for her question. And the question is to ask the Minister of Health and Sanitation on the status of incomplete hospital building at Ngongoliwa in Cholo Goliath constituency. The Ngongoliwa hospital has been in deplorable state and has stalled since 2020 and has left the community without access to essential healthcare services. I therefore request the Speaker to consider facilitating the completion of Ngongoliwa Hospital during the forthcoming budget. Mr. Speaker, sir, I would like to thank, I've thanked her already. Mr. Speaker, sir, construction of the Ngongoliwa Health Center was halted in 2020 when the overall progress had reached approximately 40%. Mr. Speaker, sir, my ministry recognizes the importance of this facility and the challenges faced by the communities due to its incomplete state. I wish to inform this August House that the ministry's integrated capital investment plan prioritizes the completion of unfinished health infrastructures, including Ngongoliwa Health Center. Currently, my ministry is actively mobilizing resources to ensure completion of this facility. Mr. Speaker, sir, I would like to encourage the honorable member to consider prioritizing it under the CDF whilst waiting for the ministry to consider in the mobilization of resources. I thank you, Mr. Speaker, sir.
Thank you, Minister of Health. Neno East.
Thank you so much, Right Honorable Speaker, for giving people of Nano East a chance to ask a supplementary question. I would want to know from the Minister of Health the criteria used in order to construct a community hospital. I have in mind an area called Kanono, where people walk a distance of 13 kilometers to reach the nearest hospital at Matope. This makes pregnant women fail to access maternity services because of a long distance. As a result, maternal death is so high in that area. I submit, Right Honorable Speaker.
Thank you. Neno East. We go to Chitipa Central. After Chitipa Central, we go to Lilongwe Site Kampuno. In that order, please.
Thank you, Right Honorable Speaker, for recognizing the great people of Chitipa Central. The people of Chitipa Central would like to know the status of rehabilitation of Mero Ward at Chitipa District Hospital. Mr. Speaker, sir, the situation is very terrible because it's cold and our patients are sleeping on corridors. I submit.
Lilongwe Kampuno.
Thank you, Right Honorable Speaker, for granting the beautiful people of Lilongwe Kampuno constituency to give a supplementary question to the Honorable Minister of Health. Firstly, let me thank you, Honorable Minister, for opening a health center in Chisapo 2 weeks ago, if I'm not mistaken. It is obviously in Baida constituency, but it is also helping other people, few residents from Lilongwe Kampuno constituency. But we need, if you may help us with a maternity wing on that health post, because in Kampuno constituency and Baida constituency, we still have few women who are delivering at home because of lack of transport, of going to Baida, and they don't have enough money to pay at Likoni Mission Hospital. Now delivery only is about 120,000. So a lot of women, they don't have that enough money to pay there. So if you can manage to give us a maternity wing at that health center. Thank you so much, Honorable Minister.
Thank you, Lilongwe Kampuno. Minister of Health.
Mr. Speaker, sir, through you, can I ask the Honorable Member for Chitipa Central to repeat his question? Thank you.
Chitipa, was it Chitipa South?
Central.
Central.
Yeah, Central.
Yeah, please repeat the question.
Yeah, thank you, Right Honorable Speaker, sir. My question was on rehabilitation of the Mero ward at Chitipa District Hospital. The rehabilitation started, I think, 9 months ago. To date, it stopped, and patients are sleeping on corridors, some actually outside covered by tents. So I was asking the status today, after 9 months, nothing is happening. Thank you, Honorable Speaker, sir.
Thank you. Yes, Honorable Minister of Health.
Thank you so much, Mr. Speaker, sir. And through you, I would like to thank the people, the beautiful people of Lilongwe Kampuno, for their question and also for appreciating just 2 or 3 weeks ago when we were opening a health center in Chisapo. And indeed, as the honorable member has mentioned, there is need for a maternity wing, and because currently the people are paying for just to be attended at the maternity and also for delivery. Mr. Speaker, sir, through you, I would like to assure the people of Lilongwe Kampuno that the maternity wing is integrated into our capital investment plan within the Ministry of Health. However, Mr. Speaker, sir, as the honorable member is already aware, resources have been decentralized to district councils, and I would like to encourage the honorable member to continue prioritizing the maternity wing through the district council and also to capitalize the CDF that has been allocated by our president through the councils. Mr. Speaker, sir, I would also like to thank the honorable member for Chitipa Central for his question. His question is to ask the ministry where on the status of the rehabilitation of male ward at the moment in Chitipa, where patients are currently sleeping in corridors. Mr. Speaker, sir, through you, let me provide an update to say, due to funds, indeed the project was stopped, but the project will continue and will ensure that the people of Chitipa, the male ward, is completely rehabilitated and people will go back to sleeping properly within the wards. The process may take time, but it's for the good of the district hospital because the renovation will help to improve the facility and will ensure that it is done. Mr. Speaker, I would also like to thank the honorable member from Neno East, where she asked about the consideration on the upgrading of a community, of a health facility to a community hospital and what exactly it takes for a hospital to be upgraded to a community hospital. Mr. Speaker, sir, through you, let me advise the honorable member and also honorable members who are here in the August House to say there are a number of considerations that are put in place to ensure that a health facility or health center is upgraded to a community hospital. And one of the requirements is that the facility should have proper housing for workers that will be working at the facility. And the housing, we are talking of more than 30 houses that has to be there because of the nature of community hospital and the services that are provided at a community hospital. Mr. Speaker, sir, let me also advise that we also consider the catchment area around the community hospital. We recommend that the community hospital should have health facilities that would be feeding into the community hospital that are around the area. So it should not be an isolated place, but rather a central place where other health centers can input or can feed into the community hospital. And again, we consider issues of theater, access to theater. We consider issues of maternal. We consider issues of transportation, that all these have to be considered. When we look at a community hospital, Mr. Speaker, sir, it is a place where all services, where even doctors, specialists are found. And it is a place that has to have enough space where construction of all these construction and theaters, wards, and everything else has to be able to be constructed. So I would like to advise the honorable member for Neno East to visit my office so that we can together assess this site and recommend if it is fit for a community hospital. Thank you, Mr. Speaker.
Thank you, Minister of Health. Mwanza Central, I got your note. Yours was question 70. I hope you have brought us some tangerines from Mwanza.
Yeah, they're in the car.
Okay. All right, Mwanza Central, please confirm question 70.
Thank you very much, Right Honorable Speaker. I rise to confirm that question 70, standing under my name, is indeed from Mwanza Central constituency, and your tangerines are in my vehicle, Right Honorable Speaker. Thank you.
Thank you, Mwanza Central. Honorable Minister of Health.
Thank you, Mr. Speaker. And through you, let me thank the honorable member for Mwanza Central for his question, which is to ask the Ministry of Health and Sanitation on the immediate steps the ministry is taking to provide Mwanza Hospital, District Hospital, with a new fully functional X-ray machine and to ensure that critical diagnostic services are restored. The restoration of the mentioned facility could also reduce the long-distance travel for patients to access basic care. Mr. Speaker, sir, my ministry is fully aware of the breakdown of the main X-ray machine at Mwanza District Hospital. We recognize the impact this has and has had on the diagnostic services and have been working tirelessly to restore full functionality and ensure uninterrupted access to essential imaging services at Mwanza District Hospital. Mr. Speaker, sir, allow me to outline steps that have been taken so far. On 29th December 2024, the ministry procured and delivered a mobile chest X-ray machine through the USAID-funded Tuberculosis Implementation Framework Agreement project. This machine operates with the district mobile clinic at the moment, which is also called Chipatala Choenda Enda, providing outreach diagnostic services. On 9 December, my ministry deployed an additional digital X-ray machine for use within Mwanza District Hospital, and though functional, this machine has limited capacity due to its smaller size. On 23 January 2025, my ministry procured and deployed a new ultrasound scanning machine, which is currently operational and supporting patients with essential diagnostic services. In July 2025, my ministry undertook site assessments, including obtaining technical specifications and room measurements in the radiology department at Mwanza District Hospital in preparation for the installation of a new fixed X-ray machine. Mr. Speaker, sir, Mwanza District Hospital is among 18 facilities earmarked to benefit from the fixed X-ray machines procured through the Global Fund, which are now awaiting delivery. Mr. Speaker, sir, when X-ray services fail at Mwanza District Hospital, patients are indeed forced to travel as far as Rusungwi, which is unacceptable. This is why the ministry is committed to installing a high-capacity, reliable fixed X-ray machine. Importantly, the machine will be placed under a service agreement of at least 3 to 5 years to prevent service interruptions due to equipment breakdowns. And my ministry is advocating for all major diagnostic equipment to be placed under such agreements. Furthermore, Mwanza District Hospital received a biomedical engineer in September 2025. My ministry is collaborating with partners to build local capacity so that minor technical issues can be resolved within the district without relying on central level support. Mr. Speaker, sir, the honorable member has raised a very important issue regarding access to diagnostic services. I would like to encourage the honorable member to consider supporting strengthening of diagnostic capacity within the constituency should local resources become available, particularly for empowering the biomedical engineer. I thank you, Mr. Speaker, sir.
Thank you, Honorable Minister. And I start with Cholo Tekelani.
Thank you so much, Right Honorable Speaker, sir, for recognizing the people of Choro Tegerani to ask the Minister of Health a supplementary question. Madam Minister, X-ray machine at Tegerani Rural Hospital is still idle. It was planted 2 years ago, commissioned, but up to now, the machine is not used. The issue surrounding not using the machine are not understandable, because the machines are modern, they were planted, but they are just saying radiation. But
what are they saying?
The issue surrounding the not starting using the X-ray machines, we are just hearing that is the issue of radiation. Yeah, so we just want to find out from the minister, when is the machine, the X-ray machine, going to be used, because it has taken a long time since the machine was planted at Tegerani Rural Hospital. Thank you so much, Right Honorable Speaker, sir.
Thank you, Cholo Tegerani. Indeed, that machine needs to start working. Let me take Mangochi West.
Thank you, Right Honorable Speaker, for this chance for the people of Mangochi West to ask a supplementary question to the Minister of Health. Through you, Right Honorable Speaker, the people of Mangochi West would like to know the factors which the Minister do consider for it to upgrade a district hospital into a central hospital. We are asking this question having in mind Mangochi District Hospital, which attend more patients more than other central hospitals, and it being a tourist destination district. I hope our visitors could be assured of good treatment if it can be transformed into a central hospital. Therefore, Madam Minister, what factors or criteria is being considered for a district hospital to be upgraded to a central hospital? Thank you, Right Honorable Speaker, sir.
Thank you. I see Zuzu City. Is it south? Southeast. You're raising a point of order. Go ahead. Mzuzu City South, I've given you the floor. Make use of it. Press the mic.
All right, thank you, Right Honorable Speaker, sir, for allowing people of Mzuzu City Southeast, under the leadership of Tie Tula, Jivesh Goamo, Kamshibazi, Kaula, Shkundula, Mafuta, and our loved block leader, Bambe, to ask a supplementary question to Honorable Minister of Health. I would like to request if our Honorable Minister of Health can consider people from Mzuzu City Southeast, if at Mapari Health Center, if we can have a theater room and with a full equipment,
And also, I would like to ask Honorable Minister of Health if they can also consider us with a good big treatment room at Mapale Health Center, because the one that we have is too small, that is not allowing to accommodate more than maybe 100 patients. So if the Honorable Minister of Health can consider us with this, we can appreciate. I thank you, Right Honorable Speaker, sir.
Thank you, Mzuzu City South, Minister of Health.
Thank you, Mr. Speaker, sir. And through you, let me thank the honorable member from Cholo Tekelani, who asked about an X-ray machine at Tekelani, which is lying idle at the moment, and is requesting and asking the ministry why it is still idle, and if it can be commissioned so that it should be used. Mr. Speaker, sir, through you, let me say to the honorable member that X-ray at Cholo Tekelani, which is lying idle at the moment, I'll make sure that I personally take it up to find out why it is lying idle. At the moment, there has to be a technical explanation why the X-ray is still idle, other than maybe just the radiation issues that are being asked or that are being mentioned at the hospital. So I'm inviting the honorable member for a cup of coffee so that after I find out, I can share why it is idle, and will ensure as a ministry that it is commissioned and it is in use. Mr. Speaker, sir, let me also thank the honorable member for Mangochi West, who has brought up a very critical issue and asking my ministry what are the factors that we consider to upgrade a district hospital to a central hospital, and he is requesting if Mangochi can be upgraded to a central hospital. Mr. Speaker, sir, this is a very critical and a very big issue that has to be considered. And as critical and important as it is, I would like to advise the honorable member that he should come up with its own request so that I can properly consider bringing it as with a separate response, with more details on why we have the central hospitals that we have and what we can do and the processes that are currently being undertaken to ensure that Mangochi Hospital is upgraded, and also the challenges that are there at the moment. Mr. Speaker, sir, I'm also thanking the honorable member from Mzuzu City Southeast for the question to my ministry, where he's asking for a theater and equipment at Mapale Community and Urban Hospital, which currently is serving a large population within Mzuzu City. Mr. Speaker, sir, indeed Mapale Community Hospital is one of the strategic community hospitals serving a larger population within the urban area in the city of Mzuzu. And my ministry, having noticed that, we allocated funds under the presidential initiative on maternal health, where maternity wing is being constructed, and I'm happy to report that the theater is under this plan. I visited Mapale it was in February this year, and I would like to assure the people of Mzuzu City Southeast that we are considering the construction of this theater and also modern equipment to ensure that Mapale is able to respond to the health needs of our women in Mzuzu City. Thank you, Mr. Speaker.
Thank you, our Minister of Health. Cholo Tegerani, you're supposed to go for a cup of coffee, set a date, so that I know the able minister will be there within a week. That radiation issue should go away. Yes, please. It's 15:30. We are going up to 15:35 so that we exhaust the remaining 5 minutes on question time. Is that okay, Leader? Okay. Thank you. We now move to question 109 in today's order paper, coming from the people of Doangala. Doangala, are you in the house? Please confirm.
Thank you, Right Honorable Speaker. I rise to confirm that question 109 appearing on order paper is indeed coming from the people of Senior Chief Chakaza and Saptie Mulalo. Thank you.
Thank you. Minister of Health.
Thank you, Mr. Speaker. And through you, let me thank the honorable member for the question, which is to ask the Minister of Health and Sanitation when construction of hospitals at Kachigamba and Tsukamakoza will resume. Mr. Speaker, sir, I would like, Mr. Speaker, sir, the House may wish to note that the facilities at Kachigamba and Tsukamakoza were constructed some time ago as lower level health facilities, namely a health post and an under 5 clinic respectively. Due to their age, limited scope and prolonged use without major rehabilitation, these structures are currently not in good condition and are unable to adequately meet the health needs of the growing population in their catchment areas. Mr. Speaker, sir, with regard to Kachigamba, the facility serves a population of approximately 9,051 people. The nearest public health facility is Chizolo Wondo Health Center, which is about 21 kilometers away. The area is classified as hard to reach, characterized by difficult terrain and geographical barriers, which severely constrain access to essential health services. And in view of the high population, long distance to the nearest facility, the geographical challenges, my ministry acknowledges the need to upgrade Kachigamba Health Post to a fully fledged health center in order to improve access to comprehensive primary healthcare services. Similarly, Mr. Speaker, sir, Tsukamakoza is currently operating as an under 5 clinic, serving a catchment population of about 4,200 people. The nearest public health facility is Chakaza Health Center, located approximately 13 kilometers away. Considering the population size and the distance to the nearest health center, the ministry recognizes that the current level of services at Tsukamakoza is inadequate. As such, there is a clear need to rehabilitate and upgrade Tsukamakoza Clinic into a health post, so that it can provide a wider range of essential health services. Mr. Speaker, sir, I'm pleased to report that the two facilities are already included in the Integrated Capital Investment Plan, where we'll be leveraging on additional resources within the District Council. As such, I'm encouraging the Honorable Member to prioritize these facilities under the CDF at the District Council to support further development and completion. I thank you, Mr. Speaker, sir.
Thank you, Minister of Health. Lilongwe City, is it the Honorable Jonathan? Unfortunately, my screen is not showing the full name. Zenza. Yes, you have the floor.
Thank you, Honorable Speaker, for recognizing the people of Lilongwe City, Zenza, to ask the Honorable Minister a supplementary question. Honorable Speaker, I must firstly commend the Minister, because last week they were in my constituency launching the lenacapavir drug, which I feel most of the people, including the media houses, are failing to pick that as a drug. They are basically thinking it's a vaccine, of which maybe even some of the members here might also think the same. So what I wanted to ask the minister is, if possible, there's need for more civic education to the masses, because it seems if even the media houses are saying this is a vaccine when it's a drug, then we might be misleading the people around us, which is not good. So my request to the minister is to consider using whatever means possible to civic educate the masses so that they understand this is a drug which is taken twice a year, to say maybe every 6 months, so that it helps each one of us, because I think even some of us will need it. We haven't gotten it, but we might need it. It's good for us. I beg to submit.
Thank you. Karonga Songwe.
Thank you, Mr. Speaker, sir, for giving opportunity to the people of Kalonga Songwe to ask a supplementary question to the Minister of Health. Mr. Speaker, sir, I'd like to ask the Minister of Health to consider constructing a health center at the Kasangani in GVH Liamayolo. As I'm speaking, Mr. Speaker, sir, the people of the lower Songo from GVH Liamayolo, Mwangukuru, Mwakamogo, they are moving a long distance to access health services. Thank you, Mr. Speaker, sir.
Thank you. Cheo Central.
Thank you, Right Honorable Speaker, for recognizing the people of Cheo Central East. I want to find out from the Honorable Minister. In fact, I'm coming from Cheo Central East, and Cheo District Hospital is very far. It's in the peripheral area of my constituency. The nearest district hospital is Baraka. So I'm wondering what happens, especially if we refer our patients to Baraka District Hospital. If these patients have been referred to Baraka District Hospital, those patients who are very serious, they are told to tell their member of parliament to ferry those patients from Baraka District Hospital to Zomba. I want to find out from the minister if he's aware about this. Thank you.
Honorable Minister, allow me to take one last one from Deza Zalanyama. He's been wanting to say something, and then you can respond to those. Deza Zalanyama.
Thank you very much, Mr. Speaker, for recognizing the people of Deza Zalanyama constituency. The people of Deza Zalanyama would like to ask or request the Minister of Health, when the Minister is going to open the Jamhi Health Center, which was constructed some 3 years ago by the Minister of Health itself with the funds from global funds. Thank you, Mr. Speaker, sir.
Thank you very much, Minister of Health.
Thank you so much, Mr. Speaker, sir. Let me thank the honorable member for Lilongwe Citizens for his question. The question was to ask the Minister of Health to consider civic education on the lenacapavir injections that were launched last week at his constituency. Mr. Speaker, sir, indeed, first let me thank the honorable member for this question and also for welcoming us at his constituency, where my ministry launched the long-acting injection called lenacapavir, which is one of the HIV prevention options that we already have and is added on to that list. Mr. Speaker, sir, indeed, civic education is a requirement, and my ministry has already put in place a number of ways on how to reach out to the masses on how this is being administered and who is required to access lenacapavir. And indeed, as he has rightly said, lenacapavir is not a vaccine, Mr. Speaker, sir. It is a treatment. And for you to receive this treatment, Mr. Speaker, sir, you have to be assessed. It's not that you just go to the hospital and receive this treatment. So you are assessed if you are at risk of contracting HIV. And you are only provided if the health worker assesses that indeed you are at high risk, number one. You are also provided if you are HIV negative, and it's provided every 6 months. So we are conducting we're using several media houses, we're using CSOs, we're using local community radios, and even local means to make sure that we are reaching out to a number of people. And actually, this injection called lenacapavir that is administered every 6 months, Mr. Speaker, sir, we had another one that was launched in 2023 called Kabla that was being administered every 2 months, which has been there. And also we had oral PrEP that was being administered since 2019. And Mr. Speaker, sir, already because of the civic education that is out there, we've noted a number of people, majority of Malawians have gotten to know about lenacapavir and have gotten to understand. And also we've raised demand for people, especially key populations that are at risk, and these are mostly like people like sex workers, those that have multiple partners, women that are pregnant, and many other people that are at risk. So, thanks to the honorable member, we will indeed ensure that we continue to sensitize the masses on this. Mr. Speaker, sir, through you, let me also thank the honorable member for Karonga Songwe for his question, which is for the ministry to consider construction of Kasangani Health Center. Mr. Speaker, sir, indeed, Kasangani Health Center is included in our capital investment plan, and we are encouraging the honorable member to consider prioritizing it under the CDF. As he is aware, resources have been decentralized to the district councils, and if this is prioritized, indeed the people of Kalonga Songwe will have a new Kasangani Health Center. Mr. Speaker, sir, let me also thank the honorable member from Ncheu Central East, who spoke with power and asked the Minister of Health and Sanitation if she is aware that people from Ncheu Central East are being referred back when they go to Balaka, which is the nearest district hospital. Mr. Speaker, sir, I would like to let the honorable member that the minister has taken note of this matter that is concerning to the people of Ncheu Central East, and we will seriously take it up. We will discuss. We want to make sure that the people of Ncheu Central East have access to nearest referral hospital, and they have access to health services at a nearby place. Mr. Speaker, sir, I would also like to thank the honorable member for Deza Zananyama, who asked my ministry to consider completion of Yambi that was constructed years ago but was not completed. Mr. Speaker, sir, indeed there were several projects that were if this can be prioritized, the people of Desert Zananyama will have access to a finished Yambi Health Center. Thank you, Mr. Speaker, sir.
Thank you, Honorable Minister, for those replies. Honorable members, it's now 15:48. Time for health break. We go for health break and we'll be back at 16:18. 16:28. No, 16:18. 16:18, House suspended.